Hello everyone, I am Dr. Donald Ozello of Championship Chiropractic in Las Vegas, Nevada. Today I'm going to be discussing what is the difference between tennis elbow and golfer's elbow. Tennis elbow is located on the outside part, which in medical terminology is the lateral part of the forearm and elbow. The medical name for tennis elbow is lateral epicondylitis, while golfer's elbow, which is also nicknamed climber's elbow, is located on the inside or the medial aspect of the forearm and elbow. The medical name for golfer's elbow is medial epicondylitis. So the main difference in these two conditions is the location. Lateral epicondylitis is also known as forearm extensor tendinopathy and lateral elbow tendinopathy and is nicknamed tennis elbow. It predominantly arises from repetitive movement with wrist extension and alternating forearm pronation and forearm supination. It occurs in racket sports, golfers, and weightlifters. It is one of the most predominant disorders of the arm, and it is more common in the dominant arm than in the non-dominant arm. It is highly associated with tennis, particularly one-handed backhand strokes. It results from repetitive microtrauma generated through overuse contraction of the wrist extensor muscles. The symptoms include pain and or burning in the lateral aspect of the elbow and forearm, and it is aggravated by active and resisted wrist extension. Pain and tenderness may be elicited upon direct palpation of the lateral epicondyle, the radiohumeral joint space, the common extensor tendon, and the proximal forearm extensor muscles. These are a hallmark of lateral epicondylitis. Grip weakness, including pain and difficulty shaking hands, may be present. Pain with resisted wrist extension or resisted middle finger extension with the elbow in extension. And there is an insidious onset and a slow progression of worsening of the symptoms. Medial epicondylitis is also known as forearm flexor tendinopathy and medial elbow tendinopathy, and it is nicknamed golfer's elbow and climber's elbow. It is pain and tenderness just distal to the medial epicondyle. The medial elbow pain occurs with repetitive wrist flexion and forearm pronation. Certain population groups are at an increased risk of getting medial epicondylitis, including overhead athletes, climbers, and golfers. It is 1/3 as frequent as lateral epicondylitis. The main contributing factor for the development of epicondylitis is repetitive movement, including a combination of forearm pronation and wrist flexion. It begins with repetitive microtrauma to the wrist flexor muscles, originating at the insertion on the medial epicondyle. Muscles most commonly involved include the pronator teres muscle and the flexor carpi radialis muscle, but can include any of the wrist flexor muscles. Cervical radiculopathy of C6 and C7 nerve roots is often associated with medial epicondylitis. The symptoms of medial epicondylitis include tenderness just distal to the medial epicondyle, medial elbow pain with repetitive wrist flexion and forearm pronation, referred pain with activities that place stress on the origin of the flexor carpi radialis muscle and the pronator teres muscle. Some people may have pain only during physically demanding activities. Tenderness over the origin of the flexor pronator mass. Other symptoms include pain on resisted wrist flexion and forearm pronation. Wrist flexion and forearm pronation may be weaker when compared to the opposite side. Chronic conditions may exhibit pain with resisted elbow flexion. Grip strength is decreased, although the magnitude is less than seen in lateral epicondylitis, and cubital tunnel syndrome may be present in 20% of patients who have medial epicondylitis. These two conditions are very similar, but they are located in different places and are caused by different motions. Lateral epicondylitis, again, is nicknamed tennis elbow, and that usually occurs from repetitive trauma of wrist extension, while medial epicondylitis, also known as golfer's elbow and climber's elbow, usually occurs due to repetitive wrist flexion and forearm pronation. When we speak of medial epicondylitis, it is the muscles that originate at the medial epicondyle. When we speak of lateral epicondylitis, it is the muscles that originate at the lateral epicondyle. These two conditions are very common and very similar, but the main difference obviously is the location and the contributing factors to the development of these conditions. I have already published videos on both of these conditions. I will place links in the description box below. If you have any questions, please leave them in the comment section. Please feel free to like this video and please subscribe to my YouTube page. Thank you very much for watching today's video. I am Dr. Donald Ozello of Championship Chiropractic in Las Vegas, Nevada.